That was my screen to remind me to do that. All right, so I think that has started. Good morning, everyone. Welcome to the quarterly meeting of the North Country Chronic Disease Prevention Coalition. It's been a while since we've been together. So I hope everyone had a great holiday season and that 2023 is off to a good start. What we're going to do today is just do some welcome and introductions very quickly. Talk about the 2022 work plan performance. We're not going to take too much time to go through the data. We'll do a very high level, quick, just kind of explain each of the graphs to you. And then, but what we really want to do is spend some time today focused on a call to action. And I'll explain that when we get there. And then we'll wrap the meeting up with a little bit just opportunity for people to share what they've been working on and the 2023 meeting schedule for the rest of the year. So really excited to see everyone here, and let's jump into it. Starting with just an introduction specifically to Lindsay from the Fort Drum Regional Planning Health Organization. We have been talking with the group. This is out in the Jefferson Lewis County area, and there are several delivery partners, delivery organizations over in that neck of the woods, and they've expressed interest in participating with us. So Lindsay, do you want to share a few words about what you've been working on over there?
Sure, and I appreciate the invite. Fort Drum Regional Health Planning Organization works really closely with North Country Initiative. We share staff. They were the PPS during DSRIP, and one of our projects, I don't know if you remember all the kind of acronyms, but it was 3C2, and it was bringing community chronic disease programs to the region. And we've created kind of a mini network there, and it just makes sense to join this broader network, especially in the world of virtual. We love what your group has been doing. So we hope to bring kind of those community chronic disease programs, and then also we have a network of providers, and we want them to be able to know that there's a resource in the greater region. So I appreciate the invite and having us a part of this conversation.
Great, thank you, Lindsay. We're happy to have you here. So because the group is large, we won't go through and do an introduction per se. I will have everyone put something in the chat. You don't have to do that now, though. We'll have an activity here toward the end of the meeting where you can, let us know that you were here and share some thoughts. So let's hold off on that until the end. Is there anyone here that would be willing to monitor the chat for me, though, in the event that there are questions that come up? I'm horrible at watching what's happening there. I need a volunteer.
I can certainly do that for you, Anne.
Okay, thank you, Ariana. All right, so 2022 performance. Lots of things happened in 2022. And like I say, we're not going to take a deep dive into all of these slides. I'm just going to quickly tell you what you're looking at, and then we'll send this out after the meeting for everyone to take a look at. A big focus for the coalition and last year's work plan and continuing into this year has been really focused on working with providers to make referrals to programs. And so what you see here on this slide is just, what that performance looked like. There are two ways providers can make referrals to programs. They can make those referrals directly through their own system or process, or they can refer through New York Connects, which is the regional network where providers can send people and get some assistance with just having the deeper conversation with patients around what would work best for them. So as you can see here, overall, we were at about 45% of our target for 2022. This slide goes through the provider referred enrollment rate, so which is separate and different than just the overall enrollment rate. So enrollment as a result of a provider referral. Overall here, you can see that the overall enrollment rate based on a provider referral was 49%, which is about what we were projecting. We are finding that the direct provider referral rate is higher than enrollment. Enrollment rate is higher when it's a referral made by a provider directly versus going through New York Connect. So that'll be something for us to take a look at as we go through the next year. This slide is just a summary of the workshops that were offered in 2022. We were aiming to have at least 26 workshops offered, and our delivery partners offered a total of 32 workshops. The number of those had to be canceled due to lack of enrollment, but the delivery partners really came through and put themselves out there, gave us plenty of opportunities to get patients and other people in the community enrolled in a workshop. So really excited and want to congratulate the delivery partners and thank them for for all of that hard work last year. And now I'm going to turn it over to Anne Marie to let us to explain what you're seeing in the next series of slides.
Yeah, absolutely. Thank you so much, Anne. So on here, what you can see is for enrollment data. This is not showing completers per se, but it's showing the number of workshops actually completed and then the number of participants per program. So the number of participants may be slightly higher than the number of completers. I'll just reference that. So on the left, it shows the number of workshops completed. We have had a much higher level of chronic disease self-management programs offered than our diabetes self-management DPPs or chronic pain self-management. And the chronic pain self-management we'll see an increase in for 2023. As you may all recall, we recently cross-trained several peer leaders in chronic pain in 2022. The participants by program,
Sorry.
Just on the last slide. No, that's fine. Despite us having a larger number of chronic disease self-management programs offered, we are showing that there was a larger number of participants at least enrolled in our diabetes prevention programs. Okay, go ahead. You can go to the next. Thank you. So participants by county. St. Lawrence County is by far the higher performing as far as getting participants into the programs. We are seeing more programs offered in St. Lawrence County as well at this point in time. Next. And this is the number of workshops by delivery organization. As you're all aware, Claxton Medical Center has a very dedicated team to offering these. Michelle and her team do a great job ensuring that there are a variety of different opportunities offered. I want to note that in some of the referral data that was shown by Anne, we do include referral into DSMES, but that's not something that we're tracking as far as workshops. So we track the referrals into these programs, but we don't necessarily track how many of the DSMES programs or how many participants participated in those. So what you'll see here is our chronic disease self-management, chronic pain self-management, diabetes self-management, and National Diabetes Prevention Program. Next. And this is just showing the self-reported referral sources. So the data that Anne showed is data that we get from our providers or from New York Connects directly. This is showing when an individual is enrolled on Compass or enrolls themselves through gethealthynoco.org, how they're saying they're getting to this. So the registration source, when it's saying online public, that means that it's either coming through New York Connects or it's someone registering on Get Healthy NoCo. The Compass personnel, the highest number, means that it was someone who has access to Compass. So it would have been someone who signed into Compass, either a peer leader, program coordinator, they're enrolling directly into the program. So that could mean that it's a provider referred internally, or that it's someone who's calling the peer leader, and the peer leader is then getting that individual enrolled. Next. And then when we ask individuals how they heard about the program, by far, the response for healthcare provider referrals is highest. And then that second, and this lends to the strength and the quality of these programs that our delivery organizations are providing, is the word of mouth coming from a friend or family member. So we're eager, we're happy to see that our providers are telling participants about these programs, but then also that our participants who've done this in the past are sharing about it. Go ahead, Anne. And I know I ran through that quite quickly. I'm certainly happy to answer any questions, but as Anne indicated prior to starting this, we really want to focus on action for the rest of this. So certainly if you do have questions, you will have access to these slides, and I'm happy to answer any questions you have. Also, Julie and Jerome, as you know, do most of the work with our lifestyle program training and technical assistance center, and their contact information is on here as well.
Yeah. Thank you, Anne Marie. So we're flying through these slides. I'm realizing that, talking about the data isn't always the most exciting thing. We have several separate work groups that are focused on this. We've got a data team that is looking at all of this data, digesting it, thinking about it. If anyone here is intrigued and wants to participate with that group, you can certainly let me know. We also have a recruitment strategies team that's looking at a lot of the data that Anne Marie shared, and based on where people are telling us they're getting information about these workshops, making plans for improving in those areas and identifying new opportunities for us to be promoting programs. So we do have lots of different groups that are looking at this information. If you're interested in getting more involved in any of those committees, definitely let me know. But what we'd like to do is really get focused on the bottom line here. So there are a lot of nuances in the information that we just shared. Again, you'll get to look at that, and certainly if you have questions, you can feel free to ask. But the bottom line from the network's performance perspective is that last year, our delivery partners did an amazing job of getting the programs out there. That was one of our big objectives when we got started, was to build our region's capacity to make these programs available to people throughout the larger region. And I am very, very excited and pleased to see that. I think that we've accomplished that. Enrollment in these programs, however, was much lower than we were projecting. We're lower than we wanted it to be last year. So we were at about 65% of our overall target. And that's not just provider enrollment, that's just overall enrollment. So what we'd really like to do this year, this will be a big focus for this year, among any other things, but I think where this group can really help is to start thinking about how we all, as not just individuals, but as organizations, can be working to really help to increase enrollment. So that's the focus for 2023. How can you and your organization help to increase enrollment in these programs? The programs are there, they exist. We've got well-trained, well-qualified organizations to be offering these programs. How can we get more people connected to them? So the first thing, now we're going to just go through some of the strategies that we've already developed, and I would encourage you to think about these strategies if they're not strategies that you're already employing. So first of all, we ask organizations to just help promote programs. We've developed a number of tools to help make that possible. So we've got a beautiful RAC card, as you see here. It's a two-sided RAC card that we have a very large supply of. So any organization that has a way for getting these out into the hands of people that can benefit are welcome to order some of these RAC cards. Accompanying the RAC cards, we also have posters. These are 11 by 17. They're not laminated, but they are appropriate for clinical settings. They're beautiful, and this is something that you could hang in a waiting room or a public area or even a patient care room. So you can display posters. You could help to promote programs by getting active on social media. The Heart Network does promote these programs as they're coming up. This is just one example of a post that and we will boost these posts as well. So this isn't just one example of a program that we boosted. You can go to the Heart Network's social media pages and like us, follow us, share these posts. We can also share with you the original graphics and suggested language so that if you want to create your own post, it doesn't have to be a share of the Heart Network's post. You can create your own post and get that out there on social media. We definitely get a lot of engagement through social media. I don't know that we're necessarily seeing that translate completely into enrollment, but I think it's important to continue increasing awareness. You can also help to promote programs by hosting an information event or bringing a program leader from your area into an existing event that you're planning and just having them do a quick presentation or intro on, what these programs are about and the benefits of participation. We have, there is a how-to guide. I'm not using the right terminology, but the Health Initiative has created a guide for this that can be shared with leaders and with organizations to give you some tips and suggestions for how to make an event like this happen. So host an event. Anne Marie, I'm going to turn it over to you for the next couple.
Yeah, absolutely. So you could also sign up for a workshop and in. Do you want me to show my screen, Anne, for this?
Oh, maybe that would be better. I was just going to go to the website.
Oh, yes. Go ahead and go to the website. So gethealthynoco.org is an awesome portal. What's happening here on this portal is that it links directly to Compass. So whenever one of our delivery organizations in the region is putting a class as available into Compass, they that automatically populates the Get Healthy NOCO website. And Julie and Jerome have been great at working with the Compass team on identifying ways to make it more visible to our partners on how each of these classes is delivered. So for example, currently on the website at gethealthynoco.org, you can see there will be a live online diabetes prevention program offered by the Health Initiative beginning on February 21st at 6 p.m. Additionally, Alice Hyde is hosting the following day, February 22nd, a chronic disease self-management program. Finally, there's 2 telephonic classes coming up, one in February and one in April. One is for chronic pain self-management and the other is for cancer thriving and surviving. And you can go in right now and register for each of these, or you can request information at the top of the screen and type in, I want an in-person opportunity in Clifton Vine. That will then push your request to Julie and Jerome, who work with our delivery organizations on trying to, maintain a wait list, but then trying to get classes started up that fit these people in unique situations and unique locations with unique desires. So they're very good at saying, we've had someone on our wait list for the last month who really needs a chronic pain self-management. They're okay with virtual, so we need to get a chronic pain self-management class up and running, and working with our delivery partners to try and get something like that started. So on February 15th, next Wednesday at 3:00, we are hosting a webinar. This session will be recorded. We are asking people to register for this. We're going to walk through for any case managers, any individuals who interact with clients in the community, whether it be providers or case managers at a healthcare system or, at our food access sites. We'd like these people who are working with clients who may be eligible for these services to know what these programs are. So we'll do a brief overview of what these programs are and the modes of delivery, what's involved with signing up for a class, and then how to get someone enrolled. So we'll do a step-by-step intro for how to actually manually enroll one of your clients while they're sitting in front of you into the programs. So I encourage you to sign up for this. This will be recorded. This slide deck is sent out so you can copy and paste and register for the event through this slide deck following this workshop or this meeting. And share it with your partners. We do have a flyer that has been sent out at least to our regional partners. If you have not seen it yet, we'll push it out again. But push it out to your partners. Anyone that you think may be able to, may see clients or may see individuals that would be eligible for this. This will show them how to enroll.
Great. Anne Marie, are you able to put that link to register into the chat, just so that anyone that's thinking right now, oh, I want to do that, they can
Yes,
do that.
I will do that in just a moment. Absolutely.
Thank you. All right. So learn how to enroll people, sign up for a workshop yourself, or have your staff sign up for a workshop. These are all ideas and ways that you can help to promote programs and get more people enrolled. And finally, I'm going to ask Luann. Oh, go ahead.
No, I'm just glad that you remembered. Yes, sign up for a workshop yourself. It really is an incredible experience. And as you noted, the participants are the best, the second best word of mouth, advocates for these programs. And there's a reason for that. So please definitely sign up for one yourself.
Great. Thank you, Anne Marie. All right. So we'll turn it over to Luann to talk about another way that you can help to promote enrollment.
Good morning, everyone. And thank you, Anne. So a lot of the work that I've been trying to do is focusing on the practices and specifically how they can work into their daily workflows, a referral for one of their patients. And I've shared a lot of PowerPoint, and we've done a lot work with meeting with different groups. And I think that while we haven't seen necessarily that much of a increase in referrals from practices, I am getting feedback that they themselves are sharing it with all the practices, because it's always hard to get out to every single practice. I am looking for opportunities, though, from the practices for some feedback on what they are able to do, or where are the kind of pain points, if you will, or challenges with trying to get people referred to a program. For a practice, what we've recommended is that they speak with the individual. Obviously, the RAC cards are always a good visual, and there's something they can take away, as well as they can sign them up for a referral right then and there. And we've distributed to all the practices a pretty basic referral form, and it's a fillable PDF, and you just have to fax it into your county. It goes right into New York Connects. And I've done some suggestions about the ways you could potentially identify patients that might be good candidates for a self-management course, because again, not everybody is a good candidate for a self-management education course. The other thing I've really tried to do is to stress that while the providers need to understand the program and understand what we're promoting and how this could potentially help their patients, they themselves don't have to fill out the referral. It doesn't require a physician's signature. So anybody in the office, once the patient agrees that, yes, I'm willing to accept that referral and then someone contacts them to get them registered. Anybody in the office can do that. It can be, the RN, the MA, or even just your administrative front desk staff can potentially get the referral form itself sent out. And we do provide feedback. New York Connects will give you a response once the patient or the individual has signed up for a class, or if they haven't, they do let you know that as well. So I'm just wondering if there are any people on the meeting here today that are from practices that would be willing to share, their experiences at the practice level of how is this going? Have you attempted to discuss this with your patients? Have you found barriers that we might be able to help with? Do you need some more information? I mean, whatever the case may be. I don't know if there are practices here that might be able to share. Short of calling on people that I see in the list, I'm going to let you all try your best at participating. And I know it's early, but even if you can share a couple pointers that worked for you or things that you're finding that are challenging.
Hi, this is Kate from Hudson Headwaters. And I know we started with our care managers making referrals. And I know one of the difficulties we ran into is patients' unfamiliarity with sending them to a group, maybe that's virtual or online, where they don't know the leader possibly. So I know that's been an issue. I'm excited to order some of the rack cards because I'm wondering, I feel like the marketing piece of it has been also difficult for us to kind of explain the program and get people excited about it. So I'm looking forward to getting some of those into our care managers' hands and see if maybe that helps with the process a little bit.
Okay, that is really good information. Yeah, and if you just want to email me, I'm pretty sure you have my email address, Katie, or put it here in the chat, just how many you'd like. And again, as Ann said, we have thousands, so pick a good number and give me the address that's best to use to send it to you, and I'll be happy to get those out to you in the next day or so. That's good feedback, though, about not knowing who the leaders are. So, we'll take that back to our small group team and see if there's any way we could promote who some of the, facilitators would be so that they can at least put a face to it. That might be something. I know Julie and Jerome are always looking for opportunities to try to up that. But thank you so much for sharing. I appreciate that. Anyone else with feedback that we could use? Has anybody made referrals from practices that you're aware of? Like, do you know of a practice that you're working with? And I know there's some practice administrators and practice managers on the list here. Do you know of practices that have made referrals and gotten any feedback from the patient that it was good or not so good or whatever the case may be? No. Okay. Well, I think Katie saved you all. Otherwise, I was going to start calling on some of you. At least we got a little bit of feedback. I take any feedback. And if you don't want to share it here, at least email me and say, hey, this is a pain point, or this really worked for me. Not everybody at 8 o'clock in the morning wants to share what they've been attempting to do. So I certainly understand that. We continue every single week to talk amongst ourselves and figure out different ways. So every little piece of information is greatly appreciated. And thank you again, Katie, for sharing. And unless you have any questions, I think I'm done.
Thank you so much, Luann. That's
You're
great.
welcome.
And so, yes, definitely. If anyone is finding that they're having challenges, if they're getting pushback if they're offering referrals and people are giving them feedback on why they're not really interested in the referral, that's important information for us to have. It will help us to find ways and develop strategies to help you overcome those barriers. So I love that idea, Kate, well, I don't know if it was the idea. The barrier was that people are maybe skeptical of leaders that they don't know. Maybe as we're promoting these programs, we need to do a little bio on the leader so that people know who the leader is and that it's not somebody that is, somewhere else in the country, but somebody right here in the North Country. Something like that. That might be an idea for us to think about. So thank you. Any other ideas? So I've just gone through and I'm actually going to just pop this into the chat. Lots of different ways that people can be engaging. And I didn't do this. It's a little, maybe not the best way to display this. I should have put this into a slide, but any other ideas from the group, ways that you think you or others might be able to help promote enrollment in these programs? What else can we do? Is there anything else that we haven't thought of here? And if you don't want to say it out loud, that does bring us to the next step. And this is where I was suggesting that maybe we hold off on, doing who you are, where you're from, and, some kind of fun icebreaker. Instead of doing that today, what I'd like you to do is put into the chat who you are, where you're from, and just give us one thing from that list that I just posted, or maybe there's something else that you can think of, one thing that you think you can help do to help us get people enrolled in the next 30 days. I'm going for the, stages of change here. I need action. What's the action that you can commit to taking in the next 30 days? And I'd like everyone to start just popping something into the chat. And this is your attendance too. Thank you, Sarah. You're going to distribute rack cards.
And this is, I had a hand raised.
Oh, sorry. I don't see these things.
Yeah,
Go ahead.
I was just questioning, for large events, whether they're fairs. We just recently had the college international games, sizable events. Are there opportunities and is there a plan for the group here to be in attendance at those to promote? Has that been thought of, or has that been acted upon in any way? And if so, how can we learn from that and promote that?
That's a great question and a great suggestion, Shay. We do try to get to events when we're invited to events. Staffing is a little bit of a challenge, but we are in the process of recruiting. And I think in the next few weeks, we'll probably have an outreach coordinator that will be working with Luann and helping to expand outreach and engagement to organizations outside the healthcare environment. So other community-based organizations and, tabling at events, I think would be an important thing for us to be able to do. That's a great suggestion. All right, keep popping stuff in here because I'm going to follow up on this. What you're asking for, what you're telling us you're willing to do in the next 30 days, we'll be following up with you to make sure that you have the resources that you need to be able to do that. And if anyone wants to say what they're doing out loud, that would be great. Let's keep the ideas flowing here. This is discussion time. What are you going to do? Tell us what you're going to do. Pop it in the chat, but tell us too. Christy, you're going to have people sign up. Your staff. That's awesome.
Thanks to your great idea, Anne. Like I said the other day, it's a no-brainer for me, but obviously my brain was not working until you put it in there. So I think that the staff will definitely feel more comfortable of doing more outreach when they have a lot more knowledge of the workshops or the workshop and the program delivery.
Excellent.
I'm curious, you know, Chrissy, as you're saying this, I'm thinking about it, and Julie and Jerome, maybe you can shed some light on this, but we do also have peer leaders in the North Country. I'm not sure how many who are cross-trained in workplace chronic disease self-management, and that program, you know, does go through the same model. However, it is offered a little bit differently in that it is something that can be done at a workplace in theory. Julie, could you talk to that a little bit and maybe share if you know off the top of your head how many peer leaders we do have trained in our region in that?
We have quite, Jerome and I are in the same room, so it's a little echo. He's going to turn off his phone. So yeah, no, we have a great number of peer leaders. I guess you would call them your veteran leaders are actually, yes, have that credential. So yeah, there's a great number. Off the top of my head, I would say probably half, about 20 of us, I think, have that credential.
Wow.
But it's a very, very, very quick training. So if anybody who does not have that credential, I think what's that, Jerome? Like a couple hours. It's just a couple of hours to 3 hours. Yeah. So we could do that. We could do a virtual training if anybody would like to become credentialed in that as well.
So Julie, I wonder if maybe a next step with Chrissy at least is to push out to the network what's involved with workplace chronic disease self-management, and maybe a list of the current leaders in our region who have that, so that we can marry the two up. If it is something that makes sense with your work environment to offer it, it would be a great opportunity to not only offer these programs to a larger number of people, but also to give them the experience of the program in an environment that makes sense.
Mm-hmm.
Yeah, Alicia, I think that Alicia does have that credential. I think, right, Alicia? I think you were at our training in Malone with Crystal as the co-trainer. So
yes, I do have that training as well.
So yeah, so yep, that would be great. So then everybody would know their leader. So that's pretty neat. One of the
Julie,
co-leaders.
how is the workplace version different from the community?
How it's different is it would be very convenient to offer it in your workplace setting, because it's only 1 hour twice a week versus the 2.5 hours sit down or virtual. And what's pretty neat about that is it's just not any more time than it would involve in having a general meeting that you would have with colleagues.
Yeah. I wonder if this is something that we might offer. I don't know who's on here from through the care management network. If we could get care managers to actually go through a workplace program, office for the aging staff that are helping and assisting with, through New York Connects to get people connected. One of the things the reason that we had this thought was because we're hearing from people that are helping to enroll that they don't necessarily feel completely comfortable with the program. They're not really sure what it is that they're helping people to get enrolled in, which makes it hard for them to sell the program, to sell participation. So if, maybe focusing on this strategy for this next maybe few months even, would be really a way for us to get more people a better feel and more comfortable with what it is that they're trying to get people enrolled in.
Trash day, trash.
Oh, I do.
Yeah, I like that idea. I think that makes sense. We can, Julie and Jerome, let's chat about that too. And Ann and you and I will discuss it. Any of our peer leaders on the call right now are in particular interested in being the leaders for an effort such as that. I'd love for you to let us know, to let Julie and Jerome know, so we can start planning that.
Excellent. All right. Well, this has been great. This is exactly the kind of discussion that I wanted us to have. I think that, again, we could focus on the data and kind of combing through it and trying to analyze it and understand it, but we've got people that are already doing that. And so how do we just take action here? This actually did come up in our data team meeting as we were starting to look at some of this information. Well, this is all great information, but what do we want people to do with it? And here it is. And this has been great. And this is exactly what we need to do. And it'll be fun to see if, when we get to our next meeting, how this concerted effort to, taking a step in the next 30 days might lead to increased enrollment in programs. So thank you all for this discussion. Thank you for posting in the chat. We will follow up with everyone based on what you've offered to do to make sure that you have the tools and the resources that you need to be able to make that happen. So I want to open up the floor now to just hearing from other folks about what they're doing in the chronic disease prevention or self-management space. What would people like to share? I guess I can start. I'll just start with an overall, just quick 2 things on from the network perspective. One is, I think many of you have been involved in different ways with some of the work that we're doing to develop a business plan for the network. The objective is that by the end of June, we'll have a business plan, and we'll be in a good position at that point to start actively soliciting some investment in the programs that our delivery partners are offering. So we're very excited about that. We've been working with Ann Holland, who has been just fantastic and incredibly supportive. And it's really good to have someone from outside the work that we're doing kind of come in and take a look at what we're doing and help to put some structure to it. So I'm really excited about that. And you all will get more information about the outcome when we get to meetings later this year. And the second thing that I just will share that I'm really excited about is that we did receive a small grant, not a lot of money, and it's very time limited, but it's our first step toward being able to reimburse organizations that are delivering programs. We received a small grant through it's COVID money. Bottom line, it's COVID money. We have to spend it by the end of May, but it's allowing us to put some structures in place contractually so that we can start paying organizations for delivery of these programs. So if you haven't heard from me and it's something that you're interested in, please get in touch with me. We did send out the services agreements to organizations that already informed us that they were interested. But again, if I've missed you, please feel free to reach out and let me know that you want to be in on that as well. So those are a couple things from the network development side that I'd like to share. Who's the iPad that just posted that you'd like some posters and rack cards?
It's Stephanie from Washington County. I still
can't.
can't.
Of course, Stephanie. I should have known that. Okay, cool. Thank you. All right. Anyone else have anything?
In the ring.
Say what's that?
If anyone knows how to change it on Ring, let me know my name on Ring. That'd be helpful. But I do have rack cards. We'll put it in our Community Connections publication and on our Facebook page. And we also have already put in Become the Peer Leader training sessions in our Community Connections publication. And that's on our Facebook page and on our website too.
Mm-hmm. Great. Thank you, Stephanie. Speaking of peer leader training, Julie, do you want to quickly share details or just date, time, location of the next peer leader training? Are you still recruiting?
Sure. Yeah. I think we're up to 6 participants now. So maybe 7. And that begins March. You have those dates right? March to April. I think it's Jerome's pulling those up. Sorry, they're not tattooed in my brain just yet. They will be soon when we're revving up and sending everything out.
It's March 2nd through April 13th.
Oh, thank you.
You're welcome.
Yes, so we're very excited about that. We've got some new delivery partners coming on, and in looking to reach the lower region of the North Country. But even though, because it's virtual and telephonic, it's actually enhancing the whole entire North Country region. So we're very excited. Thank you, everyone.
Julie, if you're able, will you drop your email address into the chat for everyone if they want to get in touch with you on that?
Sure will.
What else? Shay, Alice Hyde team. You've got a training coming up in February. Oh wait, it is February. When does that start?
It's coming up very soon. Yeah, no, we're really excited. Charlotte Gassrich and Amanda Gibbs are doing a session coming up. I think they have 7 people signed up.
Awesome.
And looking to potentially get some more referrals, and
Good.
they did an education campaign. I will say too, we partnered with Clinton County Health Department. I see Emily on here, and I know she's going to a training, but I can't thank her enough for some of the strategies she was doing and some of the boots on the ground. So just really want to recognize her. And if she wants to share what she did, I'd welcome her. But just extending partnerships.
Thanks, Shay.
Is what we're trying to do right now.
Perfect.
I'll just add to what Shay said. Amanda did present to our primary care providers. Not all of them were able to make the meeting, but last week she presented the program to them. So hopefully that will drive a few more. And Luann is going to be getting me some RAT cards. We communicated earlier this week. So
Awesome. Yes.
good stuff.
Yeah, great. Thank you, Angie. Great to see you.
You too, Ann.
So if you guys wanted to hear what we've been doing here in Clinton County, so we got about 2,000 RAT cards from you guys, and I gave 100 of them to all of the pharmacies in Clinton County. So that was like 1,700 that we gave out. So hopefully they call me back with requests for more to put them in the medication bags for their pharmacy clients, or just having them on display at the pharmacies. We wrote a little blurb in our public health connection. So that's something that goes to all providers in our area, just letting them know that the program exists and how people can sign up. And we also have a nurse here at the health department that's meeting with the nurses in person, or virtual might be actually at this point, but just going through more in depth what our goals are and what the programs are and how the providers can help refer people and get them signed up.
That's amazing. Thank you so much, Emily. That I know that's been you've definitely been working hard on that and helping to get the word out. So that's fantastic. Thank you.
For some of our practices, we've had them or encouraged them to get partner testimonials. So there's like quotes from actual participants in the programs that they've used on their outreach materials. And we've also in the past, this is really more for, I saw Michelle on from Claxton, but we are an IPA, so we have claims data.
Okay.
So if anyone's a part of anything like that, we have actually comb lists for who would be eligible for each of the different programs, because we've got that data, and then it's providing that patient list to the primary care practices to then comb through it to say this person would be a good candidate, and then working with their care coordinators to kind of do that outreach to get them in. And then we do also have a care collaborative where we get a group of care managers together on a monthly or bi-monthly basis. So that's something, Anne Marie, I might look for you to. I'm sure we've done presentations on chronic disease programs, but I think it doesn't hurt to keep that kind of on a list of topics and remind people of the programs, and then hopefully introduce this network so there's a bigger resource to pull from.
Yeah, absolutely.
And it is interesting. We are finding that we have presented to groups like care collaboratives, but like you said, it doesn't hurt. We think it needs to be a continuous reminder, because you're charged with so much as a care manager, and it's easy to have certain priorities be looked at before you remember, okay, there's that chronic disease self-management. So the consistent reminders are important. And Lindsay, I'm happy to support presenting.
Great, thanks.
Yeah, Lindsay, I need to, and you and Luann probably should connect as well. It sounds like I'm really interested in that claims data, that the lists that you're able to generate. I think that's great.
Yep, it was helpful. We actually did do mailings. I'm not sure that was really the bang for our buck there with the cost of that. So then we turned really to more like having the practices do phone calls, because like what your data was showing is what we were seeing too, is that it's really those provider referrals first, and then kind of the word of mouth second. So those are the avenues we were going forward to.
Right, that's awesome. All right. What else? What else from the group? All right. You all know where to find us. And again, these slides will come out. So I definitely hope to hear from everyone here as we're moving into the next this quarter. So I'm just going to go ahead and wrap things up and give people back a couple of minutes in their day. So what we're trying to do is schedule our all partner meetings to allow us time to pull together the quarterly performance data. So in order to do that, we need about 6 weeks to get to that. So that would put the end of the next meeting at May 12th. So I will be sending out the meeting invites for May 12th, and then again on August 11th, and again on November 10th. And we'll keep meeting from 8 to 9. I don't know, maybe we need to send like a little coffee gift to everyone just before the meeting. I don't know. Get everybody energized. Maybe we need to do a little, I don't know, like desk exercise or something. Get the blood pumping as a warm up. Anyway. So with that, unless anyone has anything else, I'm gonna call it a day on this one. So I want to thank everyone for being there, for being here. It's great to see you, and look forward to lots of conversations in the upcoming months.
Thanks a lot, Ann.
Thanks, Ann.
Yep, I'll stick around here if anyone has any questions. I'm not going to hang up until the last one's off.
Thank you, Ann.
Thank you,
everyone.
Have a good day, everyone. Thanks, Ann. Thank you, Luann.
Thank you, everyone.